But in our studio right now is Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital. And, Joe, we're going to go down that road of the concussions again this morning, right?
Well, yeah, because of the fact that this year there's new guidelines. Within a week and a half or 2 weeks, these kids are going to be out on the field, and all the medical personnel, most notably the trainers who are out there, the athletic trainers working hard, they're under some new guidelines as they assess concussions. Now, you guys know the one test, the objective test, clinical test that we use to diagnose concussions and have used for over a decade is called the SCAT, the Sport Concussion Assessment Tool. And SCAT-2 came out in 2009, big meeting in Zurich, and they came out. SCAT-3 came out in 2013, and they met in Berlin in the fall of 2016, and the guidelines came out May 1st, 2017. So a month and a half, 2 months ago, new guidelines. For whatever reason, I don't know, they skipped 4. They went to SCAT-5. So the SCAT-5 test is out there, and everybody who does any sideline coverage or care of athletes needs to be aware of SCAT-5. This test is used in youth sports. It's used in high school, college, professional. So this tool is, so whereas a lot of things they say, hey, we don't have enough evidence or it's experimental, not so with SCAT. SCAT is used by everybody in the first day or so to try to help evaluate concussions. And again, as it has in the last couple of iterations of this, in 2017 in Berlin, it got bigger again. It's about 8 pages now. The last 2 pages are given to the athlete and the parents in the high school setting as an education piece, but the first 6 pages are all assessments of an athlete to see, number 1, are they concussed? Number 2, how bad is the concussion? And issues like that. And they made some changes that are somewhat significant. They made actually 8 changes. I'm not sure if I'll get through them all this morning. Number 1, as I mentioned, it's longer. And they mentioned right off the bat in the first sentence, don't expect this test can be done in any less than 10 minutes. I would tell people to be ready for this is closer than 20 to 20 minutes to do this test on athletes. Second area they added is an area called red flags. And I really like this a lot. This was a good move. Is one of the first assessments we have to make is, does an athlete with a concussion have signs that that concussion is unstable to where it could be actually a brain bleed or a structural problem in the brain where that person needs to be sent to the emergency room. This is one of the biggest misconceptions about concussion care. A lot of people think every time every athlete is diagnosed with concussion, they're sent to the emergency room for emergency care. And the fact is 80, 85, maybe closer to 90% of concussions are not sent directly to the emergency room for emergency care. They're evaluated, they stabilize themselves, and then the athletes are told a game plan of what they should do and how they should follow up, but not sent. We would overload all the emergency rooms with the huge number of concussions, especially sport concussions that are out there. But there are a thing called red flags, and there are about 8 or 10 red flags that if these things are there, then the person probably you need to consider whether they need emergent care in an emergency room, like repetitive vomiting, like deteriorating conscious state. So they become unconscious, they're deteriorating, they're getting worse. You don't know if that's still a concussion or a brain bleed. You need to send that person to emergency room. Mm-hmm. So these documents being used by trainers and medical personnel out there, they now have what are called red flags very early in the process of this 8-page document to begin to evaluate these kids.
Are there some more of the instances you brought? You do have some time if you want to hit a few more of those, Joe.
Yeah. Number 3 is they have a section now to look at the athlete's background. That was never on the SCAT before. So have they had a concussion before? Have they had problems in the classroom? Do they have ADHD or other neuropsychological issues that could be playing a role? And so that part has been added this year. Number 4, they actually added more options in testing. So the next part you get to is where you look at memory testing. So you ask them to remember 5 items and then ask them again in 1 minute and 5 minutes to see how good they are at remembering those 5 items. Another one they do is, say, for instance, months in reverse order. And so we ask kids, okay, starting with July, tell me the months backwards to see if they can concentrate. That's one of the tests that was unchanged. But they gave a lot more options in the memory area, just so that there's not a practice effect. So if you've been given this test before, you get used to it and you remember what the 5 items are. There's many more options out there. That's a small change.
So, Joe, when we're talking about, what's it called, SCAT 5?
SCAT 5.
SCAT 5. So every youth coach, trainer, they have to go through this now, and then they sign the document to let the organization know or school know that they did this, correct?
Well, this is not a tool for non-medical personnel.
Oh, I see.
So there is some non-medical personnel tools out there to just get a sense of what kids' symptoms are.
This is for the medical
Yeah, they're not going to ask non-medical personnel to do. For instance, I'm getting to the next is they expanded the neuro exam on the sidelines a little bit. And so that would be beyond a volunteer coach. And they talk about if a medical person is not available at the scene, asking certain questions, and then if those questions are positive, sending them to somebody who could do the SCAT in a doctor's office, in an urgent care center, in an emergency room situation sometimes for the layperson, the parent, or the coach. But the SCAT is for medical personnel that would be available. And as we've said, unfortunately, fortunately, we have a lot of medical personnel at the high schools. Those are the good trainers that are out there. In the junior high, youth setting, travel ball, many other things, there's often not medical people around to do this test. But this is strictly a medical test, and they expanded the neurology, the neuro section, a little bit. It's probably going to take a few more minutes. There are a few tests there for what is called a vestibular, a balance-related concussion. And so that, I think, is an improvement. They do have, for the first time, the return to learn on the last page. So the person says, out of school for a day, out of school for 2 or 3 days, there is a return to learn. So there's always been, the last couple of iterations of the SCAT, a return to sport, which is that concussion protocol we hear all about from the NBA to the NFL to youth and college, where they have to go through 5 stages and pass each stage before they play. There's now a similar 4-stage for return to learn as these kids are beginning to improve. And the one other thing, they did get a little more aggressive with pushing kids earlier on to at least start doing some exercise. Remember, we said if we rest the brain too long, it can actually be a negative. So in 48 to 72 hours, going for a leisurely walk, starting to do a little bit of activity so we get some brain flow back to the brain. That's number 6. One thing that I think was a deficiency was number 8. They talked about meds. Many kids have headaches or pains in other areas, and they talked about obviously not using medicines that could mask a worsening headache or an emerging brain bleed. So no aspirin, no nonsteroidals like Aleve or Advil or anything like that. Obviously, no stronger pain medicines like opiates and narcotics at this point, obviously. But the one thing they left out is they didn't mention Tylenol. And for a long time, they would say, yeah, Tylenol would be okay to give. And when you look at the fine print overall when it came out, it still says they would really rather no medicine at all being used. So there's no masking of the symptoms. And if kids are continuing to struggle with symptoms, that maybe they need to be evaluated in an emergency.
Kind of makes sense. The one thing out of all this, it's going to take longer, but we should applaud that because the kids are going to be safer. So that's the biggest thing. So fans, parents, everybody involved in these programs, keep in mind that this testing is going to take a little bit longer.
It takes longer.
All right, Joe. Great stuff. Thank you very much.
Thanks, Ray.
Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital, with us this morning.